If you have difficulty looking up, this is going to be the video for you.
Welcome to the Neck Fixx Pro YouTube channel, where we give you the tools to fix your neck for a healthier future.
We're going to go through a couple different techniques to really help improve extension. That is going to be that looking up motion, especially if you feel like you're going up and you just have that stop. That is going to be the joint. We are going to focus on working on the joint. We're going to loosen up the muscles a little bit as well, which is what we're going to start with. But really need to get those joints loosened up so that we can improve your motion and get things moving normal again. We're going to start off. First technique that we're going to use is just going to be a nice little soft tissue massage. So we're going to take those little nubs from our Neck Fixx Pro. They are going to go into the back of the neck. All we're going to do is just nice, easy, little side to side. This is our elite band that we are using. It is a little bit heavier. You can provide a little bit more pressure into the neck, into the area. But nice and easy, just kind of working up, down, kind of find those different spots, especially if you find one that is a little bit tight because those muscles are being overworked. Great way to just get them to loosen up, to relax. That'll help just to relax everything, get rid of some of the pain, but that'll take a little bit of pressure off of those joints. The looser the muscles are, the less tension there is, the less compression there is through those joints. That's going to be the first part. We want to really try and focus on loosening up the muscles. Once the muscles are a little bit looser, then we can start to really go into the joints. So I would spend anywhere from like 2, 3, 5 minutes just kind of working through all of these little muscles, even going up right into those little suboccipital muscles right in the base of the skull. Those ones can cause some of those tension headaches. A lot of times that's pretty common. If you have limited extension, limited looking up, you can get some tension within those little suboccipital muscles. That causes headaches. So just working through, again, side to side, just a little up and down. There's no real right or wrong way. Just kind of going through when those muscles feel a little bit tight, try and get them to loosen up a little bit. We're going to move into just a little general joint mobilization. So all we're going to do is we're going to be pressing the hands forward. So all it is, nice little bit of motion. You can kind of control the tension, control that force. So a little bit forward, and all you're doing is just a little look up. You're not really trying to go all the way as far as you can, but just trying to get a general mobilization of those little joints, just trying to get them moving a little bit. If you notice one side is a little bit stiffer, you can kind of bias and add a little bit of an extra pull on that one side as you're going. I would just kind of spin just a couple minutes. And same thing, kind of working up and down the spine a little bit. If you have one point that you know, like, it's sore right here, you can point to it. That's where I would go eventually, but I would start either a little bit lower or a little bit higher and then work your way towards that painful spot. A lot of times if you just start right where it is the most sore, sometimes it can be a little bit more sore and take a little bit longer to loosen up, versus if you kind of work your way into it, you're going to loosen up all of those other joints and then kind of get to that spot that really needs it the most, and it'll already be kind of eased into getting loosened up. So you'll have a little bit easier time and a little bit less stiffness, less stickiness within that joint as you start to move it, start to mobilize it. We're going to move on to the next part, which is going to be a little bit bigger motion where we're actually trying to look up, and then our hands are going to kind of follow the nose, follow where the eyes are looking. So we're going to go a little bit bigger. First one, we just kind of did a general press out, little nod. This one, we're actually going to progress. We're going to actually try and look up, try and add a little bit more pressure as we're going. You're not really trying to fight the neck. You're trying to kind of relax into it. You're trying to let the band pull into those joints. So I don't want a big push back into the band. You should just be going up and just kind of letting the band pull the neck, really try and get that extension, get that looking up, get everything loosened up as you go, as you move. that is the goal of this, is we're trying to really improve motion, improve movement, and improve especially looking up. Same thing with that one. If you want to add a little bit of a bias and you want to add that little pull one side versus the other side, that's kind of one side that feels a little bit stickier than the other, which is very common. Usually one side, either right side, left side, is going to be a little bit tighter. If you want to focus on that side and focus on getting it to move a little bit better, that is going to be the way to go. As before, we want to kind of move through the spine. So going low, going high, and then kind of working our way into the other direction. Again, really working towards that point where you feel you are the stiffest. So I'm kind of stiff at the top. I'm going to start a little bit lower. I'm going to work my way. Kind of do a couple pulls, nice and easy. And kind of sit on those different spots, those different areas. Move it up just a little bit. Don't want to do these big jumps. We're kind of going level by level. If you look at the spine, especially that cervical spine, we have a bunch of different little joints that are within the spine. So you can kind of move level to level. That'll allow all of that different motion, but especially looking up, all of those joints need to fold going backwards so that you can actually get through that full range of motion. So that's really what we're trying to focus on with using the Neck Fixx Pro, is trying to just improve that motion, get everything moving. And then as we go, we can kind of work our way up, go a little bit higher into the spine if that's where the issue is, or same thing, go a little bit lower into the spine. But really just trying to work methodically and having a little bit of a system as you are working on the neck. Should be a nice little 5 to 10 minute routine, really to try and improve that motion. I would rather have it be a shorter routine, more consistently, where you are constantly working on trying to improve that, as opposed to doing one long session throughout the day. But as with most things, a little bit of something is better than doing nothing at all. So even if you only have time in the morning, time in the evening to get one little mini session in, that is going to be a great way to start off. As you find that it helps, that it works, then you can add in a little bit more to really improve how fast you are getting better, how fast your motion is improving. Biggest goal that we need to overall have is we need to improve our motion. If we don't have motion, that's going to put a lot of stress throughout the spine. That's going to cause pain. That's going to cause abnormal stress through the neck. So the more motion we have, the more normalized our motion is. That is really going to help get our neck out of pain, get us moving better, get us back to living a normal life. We hope you're enjoying these videos. Please make sure to like and subscribe. It's going to be a great way that we can keep bringing you quality educational videos on how to fix your neck.